today, Denmark is one of the first countries lifting all the COVID restrictions. Norway, Sweden are going to follow probably in a week. Other countries are also lifting restrictions, UK, Ireland. I'd like to have your view on this. How advisable is it to lift the restrictions before a peak in Omicron is reached and while the spread is still massive? And as you said, there are new Omicron variants too that we do not know so much about. What's the danger of an upsurge afterwards? And perhaps if you can address to at what point is it reasonable for countries to actually start lifting restrictions? Thank you.
Thank you, Gunilla, and we'll start with Dr. Maria van Kerkhove.
So thanks for the question. In the last 7 days, more than 22 million cases were reported to WHO, largely driven by the Omicron variant, this variant of concern that is circulating the globe. We know that case reporting is an underestimate, and it's not a great proxy for really understanding virus circulation at the moment. What is more concerning right now for me, and I think for us, is that in the last 4 weeks, we're seeing a sharp increase in deaths around the world. And in all regions, 2 regions are relatively stable in terms of the numbers of deaths that they've reported in the last week, but 4 regions are reporting increasing trends in deaths. And that shouldn't be happening at the present time when we have tools that can actually prevent this. What WHO has continued to recommend is the use of the tools we have at hand. Countries are in very different situations around the world. We have no one solution that fits all. What our recommendations are is to apply the tools to handle 2 aspects of this virus, this dangerous virus that is circulating. One is to increase vaccination coverage so that we protect individuals from developing severe disease and death. We get patients into the clinical care pathway because early clinical care saves lives. And at the same time, do what we can to reduce the spread of this virus, using tools that are readily available, masks, physical distancing, improving and investing in ventilation where we live, where we work, where we study, supporting people to work at home, investing in surveillance and testing. All of that still applies. Now, how countries use these tools is up to them, but we are urging caution because many countries have not gone through the peak of Omicron yet. Many countries have low levels of vaccination coverage with very vulnerable individuals within their populations. And so now is not the time to lift everything all at once. We have always urged caution in applying interventions as well as lifting those interventions in a steady and in a slow way, piece by piece, because this virus is quite dynamic. And we still have a lot to learn from it. Even though we know a lot about it, we still don't know all. And so our advice is to use a comprehensive approach and to use the tools that are at hand. Again, countries are going to have to apply that to the situation that they're in, taking into consideration the spread of the virus, the population level immunity that they have in terms of past infection, as well as vaccination coverage, and in particular coverage among those who are most at risk, their capacities to respond, the relationship they have with the people within their communities. So all of those are factors that countries have to take into consideration. So we have no one solution fits all, but we are urging countries to continue to use the tools at hand to reduce the spread as well as reduce morbidity and mortality from this virus.